let's see if we can see Dr. Jo Ward. I always get really nervous that I won't be able to like find the people who've... Okay, here we go. Dr. Jo... Dr. Jo... Dr. Johanna. Oh, where is she? Dr. Jo... Okay, I'm going to have to wait for her to ask to join. There's the skin cosmetic. Accept. Oh, hey!
Hello.
Hi, Dr. Jo. Do I do Dr. Jo, Dr. Ward, Joanna?
Jo is fine. Jo is fine. Nice to see you.
Nice to meet you. Thank you so much for joining me. Now, I'm going to keep this relatively snappy because Instagram lives can be a total bore and everyone's on their lunch break. And I'm going to let you first introduce yourself and then we're going to just dive straight into what the bloody hell is Profhilo.
Yeah.
So, right, will you tell everyone who you are?
Yeah. So, yeah, I'm Dr. Jo Ward. I work at the Cosmetic Skin Clinic. I've been working in aesthetics for 14 years full time. So I spend my days doing all of these kinds of treatments in London and Buckinghamshire. So, yeah, and Profhilo is obviously one of the most popular ones. Everyone loves it. So nice to talk about it.
I love it.
Yeah, it's nice.
Oh my God. Yeah, it's really quite something, isn't it? It's fantastic treatment. So I had it about a year and a half ago and I loved it, but then I kind of forgot it existed. And then I got invited to your clinic to have it done. And I had 2 sessions. I had my last one like a few days ago or like a week ago. I can't quite remember. Yeah. And it's really hard for everyone to see, but Dr. Jo, can you explain what it is?
Yeah, so Profhilo is a booming treatment. It's made of hyaluronic acid, and hyaluronic acid is such a versatile molecule. So lots of people will be familiar with hyaluronic acid that you use as a serum, and it's lovely, and it plumps and hydrates and moisturizes the skin. But in a serum placed on the skin, you'll get about 12 hours and then it kind of disappears. So that plump hydration is always needing to be replenished. So you have to put your serums on morning and evening. What you had for Philo with my colleague Rachel is an injectable form. So we place tiny little droplets of the molecule of hyaluronic acid into the skin, and we do it very, very superficially, don't we? So you probably had a few little raised bumps for a few hours.
Yes.
Yeah. And when you place it into the dermal layer of the skin, it does some amazing things. So first of all, it gives you a long-lasting kind of hydration, a dewy glow. You can't quite put your finger on it, but your skin just looks better, right?
You just look so good, and you wake up in the morning and you think, oh, I must be doing everything right. Oh, and then you go, oh yeah, Milo that last week. Oh, that's probably why. I mean, it's worked a treat. It's like the best skin you've ever had. That's how it feels hydrated and glowy, like you've had 8 hours of great sleep and you've eaten all your veg and you've drunk all your water. It's such an amazing treatment.
It is, and you see it in as quickly as a week. So that kind of lovely glow you get, and it lasts a long time. So that's why people are willing to invest in it. It's like a long-lasting hydration. Even better, though, is that it also does something else. And that's the wow. And we'll talk about that in a moment, because I'm sure you're going to ask what it does. But it's, it's bio-remodeling of the skin. So it talks to your skin and makes it make new collagen and elastin. So there's a lot of different benefits.
So it's not like a one-hit wonder. It's not like you go and it lasts 6 months and then that's it. Can you explain a bit more about the kind of longer lasting effects? What's actually going on?
Yeah, so it's a hybrid treatment. So these little injections, they do a number of different things. So we've got in Profhilo, we've got low molecular hyaluronic acid and high molecular hyaluronic acid. So they behave slightly differently. Low is amazing for hydration. I'll spare you the heavy science, but high is good for just a little bit of plumpness and lift. And then in the long run, so we're talking way after you've got your hydration, like 6 weeks down the line, you get a new phenomenon, which is a bio-remodeling. So your collagen, your elastin, is going to be stimulated in your skin, and it triggers a new production of collagen and elastin. So it actually repairs your skin as well. It's very clever.
That's absolutely amazing. That's like a bonus I didn't think was going to be there. And what does that mean long term? Because obviously we lose collagen as we get older.
Yeah.
Does that mean we don't experience that?
Well, there's no way to stop the aging process. So we are, from about our mid-20s onwards, we are all slowly losing collagen, elastin, and hyaluronic acid. That's part of the aging process. And it actually starts as early as our late 20s. So that unfolding and the decline starts pretty early. But what we're doing with things like Profhilo is we can actually change that downturn and start to make new collagen. So we can use it on lots of different age groups, and we can use it in lots of different areas to regenerate the skin. So it's pretty amazing. And I think we really see the regeneration in some of our more mature patients.
And what do you mean by that? What's mature to you? I mean, I'm mature. I'm a very mature individual, very wise. So 60?
Well, Profhilo can be used on all different age groups because it's got universal benefits. So for someone in their 30s, it would give hydration, plumpness, dewiness, and, you know, stop the decline and press pause in a way, if you like. On a more mature patient, we see different things. So we see some people who've got quite a lot of photo damage. So they've been out in the sun and they've had a lot of UV exposure in their life. They may have a crepey neck, some wrinkles, textural changes from sun exposure. Same on the face. Décolletage often is an area where people get hit by a lot of sun exposure in their lifetime. So in these patients, we don't just see a hydration and dewy gorgeousness. We see something else. We see that remodeling process in the skin. So you see, yeah, it's amazing. You see kind of the wrinkle depth change, everything lifts, looks better, plumper, and it just happens slowly over time. So people don't realize it. And it doesn't change how you look. It just makes your skin healthier.
Yeah, what I like is that it's not as risky as something like fillers or Botox, where it really can change the shape of your face, and you can get some quite odd looking results if you don't go to the right person. Obviously, everyone who's watching, go to a registered practitioner who's got, you know, all the qualifications, but also is recommended by someone you know.
Yeah.
And so you can't overdo Profhilo, can you?
No, because it's not like that. Like you said, it doesn't change people. It doesn't, you know, if we did too much, we wouldn't morph the way you look or distort things. It just works with your tissue. I think probably, I mean, obviously there's an investment in all of this. So I guide my patients and say, look, you know, standard treatment is do 2 in quick succession. So you probably came to Rachel maybe, I don't know, in an interval of about 4 to 6 weeks.
Yes, I think it was. Yes, I think it was exactly 4. Yes.
Yeah. And then your maintenance is probably someone in your age group, maybe every 4 to 6 months, do another round, you know, keep it going. We're talking to the skin. We're keeping it behaving like a young skin. We want to turn over new collagen, new elastin, keep the hyaluronic acid content high so that the skin looks good. So you would maintain this over, you know, the long term. That's the ideal. Now, in a slightly more photo damaged skin or a skin that's a bit more wrinkled, I might do 3 treatments initially. It really depends patient to patient. I might adjust things a little bit if someone's got a little bit more damage at the center of the neck. You know, we can bespoke it to the person that's in front of us. So everyone might have a slightly different treatment to their friend based on how many different things like genetics, aging, sun exposure, whether you drink alcohol, you know, you smoke, that will all affect how your skin looks.
Is there anywhere else you can have it apart from the face, neck and décolletage?
Yeah. Well, these are face, neck décolletage is where a lot of people start. And then when they see the amazing...
It's the gateway drug.
Yeah.
Face is the gateway drug.
Often in clinic, we see people, you know, preparing for their treatment all over the place. Hands is a good one because we all like soft, lovely hands.
Yeah.
And I mean, in lockdown, those of us who are wearing gloves and in a medical environment, we've used a lot of hand gel and that kind of thing over the last couple of years. So it's lovely to rehydrate the hands and to, bio-regenerate the hands. Profhilo actually, I think it was last year, they introduced a new one called Profhilo Body. So now we literally can treat everywhere. Arms are a really popular one, tummies,
yes,
crepey tummies, or
I've got a crepey tummy because I've had 2 children and I've had cesareans, and it's the beauty of having children, and it's what happens. But I didn't know you could do it for a crepey tummy.
Yeah, crepey tummy. So it's great for skin laxity because of that bio-remodeling. So a crepey tummy responds really well to Profhilo Body. You can do it on the knees, legs, bingo wings, anywhere really that you have skin that you want to regenerate. So it's very versatile. And like you said, it's a very safe treatment. It can't really go wrong. It's not like fillers where you are absolutely paying for the precision and the expertise of the injector. This is a much more entry level and very, very, very low risk treatment.
Some people will be nervous because it's an injectable. I always tell people it's like the best drink you can have for your skin. But is there any danger? Are there any risks?
Not really. I mean, you can get a little bruise if you're unlucky, but most people will walk out. This is very much a lunchtime procedure. Most people will walk out looking absolutely fine. Risks. The way we do the treatment is very precise. We've chosen points on the face according to anatomy where we're going to get the best effect, where we don't have risk of bruising and veins and arteries that we can hit accidentally. But I would say that you're only as good as the person who's injecting you. So if you're not choosing experienced pair of hands, then things can always go wrong, but I think an experienced pair of hands makes that risk much, much, much lower.
Absolutely. What about someone who's got a lot of scar tissue? How does it react to scar tissue?
So scar tissue is a change in collagen, a change in the structural architecture. It may help support an area of scar tissue. So we often have people present with things like acne scars that they sustained when they were younger. And, 5 or 10 years ago, before Profhilo was out, we would often try and support that scar with very carefully and precise filler placement. So Profhilo, we can use it to kind of disguise them a little bit. It doesn't change the architecture of the scar, but it can certainly make your skin look better.
Is there an age where you should think about starting it, or at what age is it silly to come, when would you turn someone away and go away, live your life, spend money, go travel the world?
Yeah, that's a really good question. And I think that's really important that as practitioners, we think about that and we address that, because a 25-year-old or a 30-year-old, they can all look very different. So I think it's a pretty good one from 30s onwards. By then, you've got some changes in collagen and elastin and hyaluronic acid happening. In your 20s, you've got abundant collagen, abundant elastin, abundant hyaluronic acid. You should be out traveling the world and enjoying things, wearing good sun protection and looking after your skin. I think if we start the journey too early, we don't have the ammunition for later on. So I think from 30s onwards, when there will be a little bit of early changing, then that might be a time when we can look at, well, do we step up from really good skincare, retinols, antioxidants, good sun protection, and do we introduce just a tiny bit of hyaluronic acid for that very reason, just to plump the skin? But I'd probably say most people that we would see are kind of 35, 40 plus, and they get a lot from this treatment.
I mean, I love it so much. So I honestly think it is in the top. It's in the top 3 favorite products I've ever, you know, there's only, you can put stuff on your skin and that's lovely, and I love products and nothing will really beat good sleep, good diet, good exercise. I mean, you can have Profhilo till the cows come home. If you're not sleeping, you're drinking 3 bottles of Chardonnay a night, you're stressed, you know, Profhilo won't save you from that. But if you have the good foundations in place, you got good skincare routine, wow, it is like Christmas for skincare. So can I ask you this? If someone was treating themselves, if someone was like, oh, I've got something really important coming up in a month, in 6 weeks, what is a good treatment to team Profhilo with? Is there like a, does it have like a best buddy? If you wanted to look great in a couple of months.
Yeah, I think it has a lot of best buddies, but it depends what age group you're in and what your concern is, because aging and changing in the faces happens in a really multi-layered approach. So first of all, if we look at the outer layer, you know, the skin, some people sustain a lot of photo damage, a lot of pigmentation.
And photo damage, just, I'm sure everyone who's tuned in knows what that is, but that's sun
damage. Yeah. Apologies, sun damage. So on the outer layers of the skin, there may be something like IPL for the pigmentation and Profhilo, because you'd freshen up the pigmentation and get some hydration.
What is IPL?
So IPL is like pulse light. So we're using light therapy to fragment and treat some brown spots and things like that. If somebody has lost a lot of their fat pads, for example, as we age, we lose our fat pads, and they're really important. Profhilo is not going to change that. So maybe Profhilo and a little bit of dermal filler to give a bit of structural support and a bit of lift can help.
Yes.
Then we can combine it. And I think you had a combination treatment, didn't you? So we can combine it with some of the other lovely ones like Ultherapy and what do you say? I loved Ultherapy. So for the people watching, I had 2 treatments. I had Profhilo and this thing called Ultherapy. Can you explain? Well, I'm going to do a special on Ultherapy, but just for the sake of this, can we? So I had it because I noticed I was losing a lot of structure. I was losing a lot of tone in this area of my face, and I just wanted like a little lift, but I definitely didn't want a face. I'm nowhere near a face. I just wanted, is there something nice and easy that I can go in and do a little lift? And so I had Ultherapy. What exactly is it? Okay, yeah. So Ultherapy, another popular treatment, but really focused. It's really good for anyone that's just noticing slight changes and sagging or early descent of the jawline. Really good for just giving you a bit of tightening. So it's ultrasound energy that we use. We target different layers of the skin, and we go down to something called the SMAS, which is like the gravitational sling of the lower part of the face. And everything just gets a bit loose and tired as we get older. So we're kind of tightening it all up, tightening your collagen, stimulating new collagen, and trying to get just a little bit of kind of a stronger, tighter jawline. So that's what you had.
It was really quick. It was about maybe half an hour, 40 minutes. And obviously Rachel numbed my face, but it didn't have very much at all. It was like a little bit spicy at points. It was a little bit hot, but it really wasn't that bad at all. She's just got the gift, which of course she does because she's great. But I was really surprised. And I think that it's starting to kick in. It's really hard to know. But I mean, I think it's probably a bit too soon. I don't know. But I do feel like I feel like it started to like go.
Yes. Well, some people kind of feel tight from the moment they've had the treatment.
Really?
And then it just gets better and better. So we review people after therapy at like 3 and 6 months. So it's one that you have to plan for, because it does take, even with Profhilo, it takes 6 weeks for new collagen to be made. So it's not an overnight quick fix like Profhilo. You get your hydration within about a week. So it's more of a slow burner, but it's really, really nice. And again, the nice thing is it just happens so slowly that nobody really notices. And that's a good thing.
Absolutely. I mean, there are lots of people who want treatments and don't want to talk about it. So, you know, like you say, it's all very gentle. I want to tell everyone, because the ones that are good, I want to share them with everyone. Now, we've got 1 minute left. This is a whistle stop tour. Is there anything that I should have asked about Profhilo that you think people will want to know? I mean, to me, it's a really simple procedure. It's an injectable. It's like the best drink your skin's ever had.
Yes.
Anything else?
I think we've covered it. I mean, I think a lot of people don't know this, but for a very long time, it's only been available in Europe. So we've had people from America coming over to have their Profhilo. There's been a lot of influx from overseas because it hasn't been, it's an Italian product, and it hasn't been available because it was waiting for FDA approval in the States. So I do think that now, as it hits America, it's going to become a household name, rather like some of the other names. And I think we're going to see a huge growth in it and a huge uptake because, like you say, it's so lovely, it's so natural, it's minimal downtime, and people are busy, and it just gives you so much more.
I mean, I love skincare, but for that long-lasting juiciness, it is
Pretty
great.
good.
But like I say, you know, you can't Profhilo your way out of SPF, good night's sleep, and good diet and feeling happy. But it does. It's a really great boost. Dr. Jo Ward, thank you so much for joining me. I really appreciate it. And for anyone watching, if you've got any other questions, feel free to DM me, or I'm sure Jo will be open to messages.
Yeah, sure.
That was a whistle-stop tour, 20 minutes with Jo Ward about Profhilo, a treatment I love. All right.
Thanks for having me. Take care. Bye.